Inclusive health is a journey. We can all take action to remove barriers and improve access to health services for people with intellectual disabilities. But sometimes it's hard to know where to start. And that's why Special Olympics has developed 4 key strategies to help you. These strategies include welcoming spaces, communication, awareness and training, and sustainable and intentional inclusion. Accessible communication is one of the first steps you can take to include people with ID in your programs and services. Ensuring your communication, including written communication, is accessible to people with intellectual disabilities is critical to ensuring equitable access to health services. There are a number of actions you can take to make your communication accessible to all patients, including speaking directly to the individual, not his or her caretaker, using plain language, written materials at no more than a 6th grade reading level, avoiding jargon, acronyms, and abstract statements, incorporating pictures to show meaning, providing in-person assistance to ensure patients understand materials and can complete forms, including images of people with ID in your promotional materials. At the Complex Care Center at the University of Rochester, proper communication starts even before the patient comes in.
So when a patient or caregiver reaches out to our clinic for a new patient visit, for example, for primary care, we call them to book that first visit. We call them 2 days before and make sure we've identified any caregivers that might be giving them rides or support during that visit, so we can also contact them for reminder calls. And then at the first visit, they're invited to check in on their own with the support of their caregivers if they bring them with them. As the secretary is checking them in, she will outline to them that they're going to work together, she is the secretary, to help them check in independently in the future.
They understand their patient is, in this case, my son, but they also understand that as a caregiver, we need to be included in the process, but it's nice that Tim is the main focal point.
At the East River Road Clinic at the University of Rochester, a clinic that is specifically for pediatric patients, staff are trained to communicate with patients in an accessible manner.
We teach our staff about things like using visual support so that you can have a visual.
When I check them in, they know they need to take their shoes off. Then we do weight, then we do height, then we do blood pressure, and sometimes we need a head circumference. So they look at the pictures and they go right down them and they know what's expected. And that helps.
We teach them things like first then approach. So first take your shoes off, then I will grab you a toy.
Making it calm, clear, and precise. And routine. Every time a child comes in, make it routine. They know what to expect.
I love working with patients who aren't verbal, and most of my patients are not verbal. It can be really fun to interact with them, and families are so appreciative when providers just take the time to do that. And so the things I think of when working with a child who's nonverbal is starting off by getting at the child's eye level so that they're looking at you directly, and speaking to the child as you would any other child. Most children will really respond to that, and really making sure to continue to include the child in the whole visit and check in with the child, that no parent wants to feel like their child is being ignored during a visit.
The most rewarding part of my job is seeing the smiles on patients' faces when they're happy. A lot of the patients are nonverbal, so when you get the smiles, you know that they're content.
The people here, everyone's so friendly. They listen to me.
I can talk to the doctors here because they respect me, listen to me, and make me feel comfortable.
Remember, using accessible communication helps not only patients with ID, but all members of your community. For more inclusive health strategies, visit www.inclusivehealthcenter.org. Everyone has the same right to health. Don't wait for someone else to make it happen. Join the inclusion revolution.